Okay, dan soalan macam mana nak jadi cardiologist di Malaysia? Dia sama je Malaysia ke di Prague ni pun. You have to jadi doktor dulu. Jadilah doktor dulu. Lepas tu bila dah, I suggest you go through your posting dulu. Mungkin macam saya memang dah set saya punya mind. So you might be like me juga. Tapi kalau you punya minat memang cardiology, so I guess bila you buat internal medicine nanti, you must know and befriend the who's who. Maknanya consultant cardiologist tu you kena baiklah sikit dengan dia. Sebabnya you have to compete, and kalau misalnya dia nampak you punya attitude betul and you are really hardworking, and you can actually be very reliable, then his or her recommendation will be very very helpful. Itu penting lah tu. Okay. Ada sikit lagi. Pasal saya suka yang soalan ni. Pasal okay, this one kalau kita ada masalah untuk jadi extraordinary student, masihkah boleh possible untuk jadi extraordinary doctor? Tapi OSEM ni kan ordinary student, tapi jadi extraordinary doctor, so I think again I have problem defining this ordinary and extraordinary. Aku rasa macam extraordinary macam X-Men gitu kan. So what? You don't have to be that extraordinary lah. I just want you to be having the right attitude. Itu yang important sangat-sangat. And if you have that, you are more than extraordinary to me. Yang extraordinary itu pada siapa? Pada you sendiri ke atau apa? To me, your doctor, ada salah satu slide penting Dr. Hafizah baca tadi. You must be at least hardworking atau tunjukkan ke enthusiasm you nak jadi doktor ni. Sebabnya kalau you sendiri pun nak pergi jumpa doktor, you tak nak jumpa doktor yang malas. You tak nak jumpa doktor yang mungkin daripada tadi 10 causes of loss of consciousness, dia hanya tahu 5. You kalau boleh nak jumpa doktor yang amat berpengetahuan. Tapi some of you might have repeated years, I have repeated ni. Yang ini kan patient tak payah tahu. You jangan letak dalam name tag tu, contoh Dr. Muiz, saya repeat tahun 2. Tak payah, yang patient tu tak kisah pun tu. Janganlah dia besok pakcik, saya ni tak berapa pandai, saya ni tak berapa extraordinary, biasa-biasa je, tahun 3 saya fail. Tak payah cerita dengan patient. Okay? Okay. So don't worry lah, you will be, to me, this extraordinary ni just because committee member, committee organizer ni nak letak nama OSEM tu kan, jadi dia kena think very hard. O tu apa, E tu apa, so dapatlah ordinary and extraordinary. So don't worry, you just do whatever you could, the best you should. Okay. Now, can we develop critical thinking if you are not born to have the skill? I thought I told you that you can learn it. Okay, maybe what you want is how do you learn it? Of course, kat sini saya hanya memberikan dia punya exposure, tapi you can actually learn a lot. Kalau saya ada a whole day punya session on critical thinking saja, I have a lot of questions. Macam mana you nak critical? Cumanya kadang kalau you jenis macam ni lah, you kata you tak ada critical thinking, I punya training nanti buatkan you lagi depressed. Sebab orang lain dah dapat opinion, you tak dapat lagi. So tak apa dulu. So you might just have to start to think critically. Maksud dia, yang saya cakap ni, okay, look at emotional intelligence nanti, try to be critical in the content that I just gave you. Okay, right. Finally, the same person asked, how to balance between family life and doctor's life. Okay, kat sini mungkin saya di masa di UK baru ni memang itu je topik yang paling hangat, sebabnya ramai PhD student and they have their families kan. So soalan FAQ lah untuk saya dan Dr. Hafizah ni, tak pernah ditanya kepada doktor lelaki. Yang perempuan dia, how do you juggle and how do you balance your life, doctor, as a wife, as a doctor, as a mother, as a social activist. Aku ingat juggling dengan balancing ni ada dekat sarkis je, So reporter ni mesti ingat rumah aku punya sarkis ni kan, I selalu tanya reporter ni, do you ask the same question when you are interviewing CEO, a male CEO? No lah doktor. Why? I think the same question has to be there as well. How do you juggle all your duties as a husband, as a father, and as a CEO? Siapa nak tanya? Well, sebab itu orang perempuan dia ada kat rumah nak jaga. So bila orang perempuan macam ni, suami dia jadi house husband kan? So all the sort of thing lah. But macam mana juggling ni, I'm not going to explain secara ni, but I need to go into my emotional intelligence ni. But macam ni je lah, you will be a balanced person if you know how to prioritize. The problem with you young people is that you still are very very weak and unexperienced in prioritizing. Ada juga soalan tadi orang yang procrastinate, study dalam minute. Sebab apa? Ni kalau study dengan stres tu lagi bagus, tak ada stres tu tak bagus. Apa punya argument tu? Stres tu sebenarnya kau yang put. I will always study very consistently because I have that constant stress and pressure to perform. I remember in my class, I must, kalau masa yang pre-clinical, bila lecturer tengah bagi talk macam ni kan, atau bagi lecture, I must understand that. Sebab malam nanti I kena ajar my friend. So kawan I kat sebelah dia tidur. Harap aku nak tidur, kau tengah betul-betul lah. Betul? Tak apalah. Jadi malam ni, dan I always feel very pressured, but I like the pressure. I feel very pressured to explain that in a different way, in a better way. So bila cikgu tengah ajar tu, otak ni cepat jalan macam mana aku nak explain cara yang lebih bagus lagi. Bukannya nak sombong dengan cikgu tu tak tahu aku ajar lagi bagus dengan dia. Tapi that is actually the challenge yang I ada. Okay, bukan malam ni memang I kena mengajar my friend. Okay, so most probably to bergantung kepada what you define as stress. And I suggest you feel the pressure right from the very beginning. Kalau misalnya ada some of you are very smart, I know. Belajar sikit je dah pandai. Kan ada nyampah kita tengok kan. Kita ni belajar macam narak lah. Susahnya nak. Dia main-main aja study dah okay. Okay, this kind of people dia ada ujian dia. They are not tested on hardship sebenarnya. Okay. But I would like to ask these people who are very smart, can you please at least give yourself to others? Teach your friend who is struggling. And then janganlah buat relax ni. Kau bolehlah relax, dia tak boleh relax kan. So benda-benda macam ni lah. Jadinya most probably itu yang peribahasa kata ringan sama di jinjing, berat sama di pikul. Boleh? Okay, can we move on? Alright.
Bagaimana ingin mengembangkan atau menyumbang kepada masyarakat yang kita tidak dapat manfaat apa-apa daripada mereka, malah mereka menunjukkan perilaku yang tidak menyenangkan kepada kita. Okay, bila kita menyumbang dalam masyarakat, I think dia bermula dengan niat dan mindset kita. Niat duduk kat dalam, mindset duduk kat atas, kan? Biasalah agaknya memang kita tertrain, atau umumnya masyarakat, orang biasa dia akan mengatakan apa je dia lakukan, dia akan kata what is it there for me, kan? Apa benda manfaat untuk kita, kan? Jadi itu sebabnya kita kata masyarakat memang tak bagi kepada kita, ataupun memang teruk dah masyarakat ni, dia lah pula susahkan kita. Maka dengan mindset seperti itu, rasanya kita akan jadi lagi tak nak bagilah. Tetapi bayangkan kalau kita rasa bahawa sumbang kita dalam masyarakat sama ada dengan memberi khidmat ataupun dalam memberi nasihat, apa dalam sudut Islam yang kita sebut dakwah. Kalau kita lihat tu sebagai beban, maka beratlah. Kita ajak orang tak nak dengar. Contoh Alif ataupun Shenza ni buat program, panggil orang tak nak datang. Kita kata, malas lah lagi buat. Betul tak? Tetapi kalau kita meletakkan atau dalam niat kita tu merasakan bahawa inilah tugas yang merupakan satu penghormatan untuk kita, untuk menyumbang dalam masyarakat, berubah cara pemikiran kita. Kita akan menjadi kreatif. Ya. Ajak sekali tak ada orang respon je. Alhamdulillah hari ni 200 orang, masya-Allah. Beri tepukan rasanya kepada Syamzah. Tapi kalau kita walaupun tak ada orang, tapi kita merasakan bahawa tak ada orang dengar, ataupun orang tu yang dengar cakap banyak kali pun tak nak ikut, contohnya kan. Masyarakat okeylah, kita katalah nanti keluarga kita sendiri. Ya. Ini you all, majoriti tak kahwin lagi kan. Ya, ada beberapa orang je yang alhamdulillah dah berumah tangga. Ini satu kan. Kalau saya suruh husband I tu tak pernah nak berubah, contohnya kan. Ya. Ajak dia memang tak nak ikut punya, contohnya kan. Kalau lah mindset kita begitu, agaknya kita akan letih. Sebab kita meletakkan bahawa kitalah yang mempunyai kuasa untuk menyebabkan dia berubah. Nampak tak? Perubahan tu, kalaulah kita rasa bahawa kita yang menyebabkan dia berubah, maka kita akan cepat frust dan putus asa. Tapi kalau kita merasa bahawa tugas kita hanyalah untuk menyampaikan, dan it's an honor for us tau, ni penghormatan. Kita akan ditanya nanti bukan atas hasil kita, tapi atas usaha yang kita lakukan. Contoh ada satu soalan yang mengatakan, macam mana kalau saya dah try dah, ya saya dah usaha dah, tapi saya rasa macam saya tadilah yang sampai putus asa. Ya. Saya ada seorang student yang juga punya problem, dan saya pergi lecture, tapi tak tahu kenapa saya tak boleh nak tangkap. Ya, saya macam susah nak faham. On the verge of, saya rasa frust, putus asa. Bukan saya lah tu agaknya kan. Yes. Kalau macam tu memang kita akan frust lah. Tapi kalau kita merasakan tadi, sedar diri bahawa kalaulah kita tu tak cakap dia IQ tak cukup, takkannya sampai kat check ni. Tapi kita tak faham juga. Mungkin ada teknik dia yang tak betul, mungkin approach kita yang tak betul. Yang tu yang kadang-kadang tadi group discussion tu lebih ni menjawab lagi satu soalan kan. Ada satu soalan tu dia kata, macam mana kalau saya memang tak suka group discussion ni, sebab setiap kali saya pergi group discussion, saya rasa macam saya tak tahu banyak, lagi buat saya depressed sebab orang lain lagi tahu banyak. Contohnya kan. Dan kita kena review balik lah our approach to group discussion kan. Jadi mungkin di sana perlu ada di sana satu pengubahsuaian lah, cara macam mana dia nak dibuat group discussion tu kan. Jadi mungkin dengan bagi-bagi topik kan, ya, dengan apa tu, memberikan lagi empowerment, mungkin kena ada facilitator di kalangan kita. Jadi tu nak buat supaya group discussion tu lebih interesting kan. Okey, soalan yang seterusnya. Okey, apakah nasihat doktor terhadap kami bakal graduan yang masih mempunyai 2 atau 3 bulan berbaki sebelum bergelar doktor? Okey, kalau ikut inilah pecutan terakhir, betul tak? Yes, inilah pecutan terakhir. Jadi kalaulah pernah tengok tak orang baru ni kita ada Formula 1 kat Malaysia kan? Ya, pernah tak try masuk dekat simulator pun cukup lah. Ya. Dia kata kalau driver tu, yang F1 driver tu, dia punya thrill tu adalah bila tekan yang dia punya minyak tu, adalah tekan. Kita kan drive kereta juga kan, tapi pernah try press sampai habis tak? Tak pernah kan. Pernah habis dalam latihan kat situ kan. Tapi yang driver dekat Formula 1 tu, yang boleh jadi dia hebat tu, the part of the thrill is that bila press minyak tu sampai habis. Push yourself to the limit. So kalau 2-3 bulan lagi nak habis, maknanya nak exam ke dan sebagainya, I think this is the time to put yourself, fully into it kan. Dan kemudian tadilah menyediakan mindset dan sebagainya. Ada juga yang sebutkan macam mana ya, nanti balik macam mana nak buat, nak rasa, nak hilangkan rasa inferior ya, bila kita berdepan dengan kawan-kawan kat Malaysia tu yang nampak macam tempatan macam lebih hebat daripada kita kan. So akhirnya bagi saya ya, boleh saya simpulkan sebagai apa pun bermula dalam diri kita, the way we see ourselves kan. Macam mana kita rate diri kita, macam itulah kita berdepan dengan orang ya. Saya ceritakan tadi satu kisah seorang sahabat saya yang balik ke Malaysia masa dia buat elektif ya. Masa dia buat elektif tu, dia berjumpa dengan satu konsultan lah dekat apa tu hospital tersebut. Yang tahu dia ni graduan daripada Australia. So konsultan tu cara dia kata, oh come, you must be coming from overseas. Lepas tu dia bawa student-student dia yang lain. Kita tanya, dia mengerti cerdik ni kan, dia dah datang daripada overseas ni. Kita tanya dia, dan tanya tu memang killer question lah. Masa tu dia baru nak start clinical dia, jadi memang zero lah kan pengetahuan. Lepas tu tanya bombat dia tu, memang soalan-soalan yang memang merendahkan dia. Lepas tu konsultan kata, dia ni kan, dia bodoh kan, dia tak reti kan. Memanglah down betul masa tu kan. And she went into depression. Ini kisah kawan saya yang saya rapat sangat dengan dia. Dahsyat gila lah dia punya penangan. Maknanya it's a challenge bagi after a while, alhamdulillah, dengan sokongan dan sebagainya, she come out of it. Macam mana cara dia? Satu hari dia sampai jumpa psikiatri, dia alhamdulillah, oleh sebab tadi IQ terror tu, pandai tu, jadi akhirnya dia pass juga medical school. Balik Malaysia, memang hospital phobia. Ini memang hospital phobia. Memang tak boleh, dia tak start pun internship dia. Tapi memang orang terror kan. Sampai pergi jumpa psikiatris Dan apabila dah session tu, last one, akhir sekali lah, agaknya pakai jiwa tu, tak tahu nak buat apa budak ni kan, sebab she knows everything. So last kali dia kata, I think you ni sebenarnya kacang putih je you boleh buat ni. You just tadilah flip your emotion kan, tukar je pemikiran. Apa yang takut sangat, you memang cerdik bukan? Dengar je bahawa this is actually, kacang putih lah, simple sangat sebenarnya. This is chicken feet lah. Apa boleh tak boleh nak halang, tak boleh nak lawan lah, mana dia kan. Dan alhamdulillah that particular word tu, entah apa lah agaknya, start to click in her brain tadi, and menukar, and now jadi pakar-pakar dah. Doing PhD ke Australia balik kan, lecturer betul. Jadi nak bagi tahu, akhirnya balik semula pokok pangkal diri sendiri. Macam mana kita melihat diri kita? So bagi saya, Masya Allah, you are the best. Your potential is large and huge. Cuma mungkin kita adalah kekurangan dari sudut mungkin experience kan. Jadi never mind. Lalui dia. Persetankan apa orang katakan. Tadilah kena jadi telinga gajah tu lah, tebalkan telinga tu. And acknowledge that you may be lacking in certain things. Tapi ini bukan fast learner ke semua ni, right? InsyaAllah kacang putih lah semua ni. InsyaAllah kan, maknanya mudahlah, mudah-mudahan kan. Tadi confidence di dalam kan. Jadi insyaAllah. So bagi saya, part of the discussion group tadi kan, saya juga dapati this one saya juga alami satu language barrier. Saya ingat lagi masa saya belajar dulu, kita orang paling suspense sangat. Kita ada belajar tu role playing, role play ni is the best way to learn actually kan. You jadi actor kat situ kan. Tapi masa tu oleh sebab kami punya language barrier dan sebagainya, then we find this, inilah paling gedebak-gedebak sangat kalau kena buat role play tu kan. Tapi I tell you, inilah masa yang paling baik untuk belajar. So the best way to learn is to present. Okay, apa yang membezakan antara seorang doktor yang ilmu dia, kepala dia besar tentu, banyak ilmu, dengan seorang doktor yang memang nampak confident adalah cara dia present. So the more you present, betul tak? Bila kita present, apa yang kita buat? Kita keluarkan balik apa yang kita belajar. So itu memang boleh praktis daripada sekarang lagi. Presentation skill, yang tu kita kena master. Dan sebagaimana saya sebut tadi, jarang-jarang aja yang Allah bagi, setengah orang aja yang dia pandai tiba-tiba. Majority of us kena buat apa? Practice makes perfect. So I think I stop there dulu. Tahap. Ini dah memang long day for her. Ada few questions.
This is related to the emotional intelligence. I have a problem of mood swing. How do I use this kind of emotion for a better good? Okay. Well, enjoy your mood swing. What I mean to say is that sometimes people yang ada mood swing ni because agaknya you have a lot of disruption. Kadang you happy, lepas tu kan suddenly you crash down, and because of that you become very unpredictable. People might find you tadi dia happy-happy, tiba-tiba dah monyong dah. Did I do anything wrong? Tak. Dia memang mood swing dia. Kalau you dah dekat nak period, well, that is actually part of your premenstrual tension, premenstrual syndrome. Kalau PMT ni can be very severe. Remember guys, kalau misalnya girlfriend you ada PMS ke, she might kill you, during that PMS. Betul, ada documented ni. Dia tengah PMS, boyfriend dia lambat datang for dating tu, dia sekeh kepala kawan tu sampai memang masuk ICU. Because and she was acquitted. She was not found to be guilty because she could prove that was because of PMT. It is actually considered as a valid reason. But most probably kalau mood swing you datang dekat-dekat nak period, you tahu that is actually dekat-dekat your period. Tapi kalau you macam bayi-bayi you ada mood swing, that might be dekat nak menopause. So cannot be. Okay. So to me, a good friend would be really helpful to tell you that, hey, you're having your mood swing now. So dia boleh tolong you untuk at least to help you not to succumb so much on your mood swing. Boleh? Okay. Ni pasal PPD, you kata ada tak yang dianjurkan oleh KM ni buka untuk pelajar perubatan luar negara? I think I should lah. Kau boleh buat bisnes sikit kau, When I presented this in Malaga, Spain, in our representation, the room yang dia sebenarnya side presentation tu, maknanya concurrent session tu ada 20 concurrent session. So you pilih lah, daripada 1,000 participant tu, you nak masuk room yang mana yang related dengan you, kan. So masa I nak present tu, the room was full. It was actually not lah a big room, tapi penuh bilik tu. So the one presenting before me was a Swedish, and then there's another French, and then I. Lepas I tu Pakistani, but it's actually a British lah, Pakistani. So I presented this camp. Rupanya in the abstract, it attracted many people to want to listen to it. So the question macam ni lah, can we send our student to you? Okay, and then of course the gambar-gambar, the tropical jungle semua tu suka sangat lah. Where do you get the money from? So I said, because we are prioritizing this, so we actually set aside money. Habis saya present, bodoh-bodoh orang keluar. And then the French person and the Pakistani doctor who wants to present after me, obviously they are here for you, not for me. Dia memang biasalah untuk presentation, but memang dia memang catch a lot of attention. That's why saya dapat, we all dapat that best jury award for the medical innovation. I'm writing it up to send to medical journal, because especially the outdoor camp, this is where you can instill leadership and teamwork. Macam you all tengah buat ni lah. This is cumanya mungkin Azan and the committee tak dapat merit lah. Macam my student, they got a lot of merit. Dia masuk dalam calculation of student punya point. So that is actually part of it. You can agaknya buatlah sikit sama camp ke apa ke, and can invite me again lah. Tak adalah. Tapi I can give you the curriculum sikit lah. Okay. Now, cabaran yang doktor hadapi sebagai pakar ONG, isteri, ibu, kan aku kata ni FAQ kan, frequently asked question. Macam doktor cakap tadi, is prioritizing. Why am I here? Because the priority is my family. My family is not my liability. I'm becoming who I am because of my family. Kita orang perempuan ni selalu gunakan family as kita punya keuzuran, liability. Oh, I tak boleh lah nak buat ONG ni sebab my husband needs me, my children needs me. Well, okay, kalau you bagi I reason tu, I will not dispute. Itu uzur syar'i. Uzur tu kita tak dispute punya. Cuma I nak tanya je betul-betul. Is it really your liability? You ni duk kata family I tak boleh buat tu. Memang tak boleh lah. Now, how do I get the family that I got? It's not by accident. I pray for this man who is now married to me. Of course I don't pray him lah nama dia Zulkifli Ahmad, tak. I give Ya Allah, I really want to do my best potential, and I know I'm highly potential. So please send me somebody who will support me, and I will support him. Whoever he is. Alright? So alhamdulillah datanglah dia. Dia bukan datang sekonyong-konyong macam Frog Prince, tak. Tapi maknanya, and I do not actually shut myself out as I'm not going to get married. No, I want to get married. I know I'm going to be a very good wife to a man, and that man is going to be one of the luckiest men on earth to be married to me. But I have to have that confidence lah. And I equip myself with all that. I have a very good emotional intelligence. So a man who's going to live with me is going to have a blissful life, because I'm emotionally clever, right? And I pray to God to have the kind of children that I have. The one who can do their homework without my supervision, so that I can go for meetings. Because the other day I realized, my friend who is another consultant like me, how can you actually spend time going for the meetings? I heard you go during the nights. That's the only time. During the day I'm in the hospital. Anak-anak you buat homework without you? I said yes. Oh, anak aku tak boleh. Aku tak ada kat situ joli katak dia. Tak buat homework punya. Well, this is not my doing. Allah sent me 3 beautiful children who can be on their own. Kalau I kata my family needs me, betul lah dapat anak yang tak buat homework kalau maknya tak ada di situ. So my time is going to be used up for that. I have a husband who allow me to be away from him for 11 days for this trip. And you know why? Because they kata you have to go there representing all of their mothers. Because when you go there, it's as if their mothers going in. Betul kan? Maybe your mother is slimmer than me or fatter than me, I do not know. But the fact that I'm coming here and me and Dr. Hafizah, and I know how it feels agaknya having one daughter now in Casablanca. Dr. Hafizah ada anak dia dekat Egypt. So we know how it feels, and we know how your parents feel. Okay? So I know, send my salam to your mothers, and your father, say that you are fine. I think you are fine. You'll be fine. Okay. Macam mana kalau nak ambil mandik ni sebab family yang suruh, and even now I don't feel that for this kind of people, you are not here by accident. If this is not your place, you wouldn't be here, even you being forced at gunpoint. There must be a reason why everything fits, everything clicks, and here you are. Who knows, this is actually the best time of your life, away from your parents who think so much for you, and you will return a better person. So whatever it is, it's going to be good for you anyway. Okay. Sikit lagi. Bila best time nak buat specialization, right away or after a period of time? It depends actually. I make my decision way ahead. At the age of 15, I already decided my specialty. It never change. So bila habis okay, I was the best student for my medical course as well. Tapi masa tu berita harian tak datang interview. So tak adalah gambar aku nak tunjuk. Tapi masa tu the top 30 student was offered by UKM to return back as our trainee lecturer. Soalan untuk siapa macam mana nak terlibat dalam bidang pendidikan perubatan. I was actually offered, because UKM ada scheme where the best 30 student is going to be offered a place back to come as a teaching staff. So at that time, we were offered to just do whatever course we want. So dia akan ambil yang seplus tu. So we only see dulu tempat-tempat tu. It's really worth it doing the best and be the best sebenarnya. You have a lot of choice in your hand. So I choose ONG. Then of course I go through the training. Saya become a specialist, I become a teacher dekat department tu sendiri. Okay? So if you really want to be a teacher in medical education, fine, but do your specialty dulu. You jangan buat general je terus jadi medical educator, dia tak berapa ni. Macam I sekarang ni, my main specialty in education is professionalism and clinical teaching, because I'm a clinician. So tapi I think not everybody can teach sebenarnya. Only those people who really want and have the passion. Okay. So kalau nak buat segera atau tidak tu, satu, tengok macam mana you punya ni. Macam sekarang ni you have no idea, I think you better go through all the posting and see which one fits you, and then also tengoklah your situation and everything. However, you must remember, in Ministry of Health there is a queue. Ada queue depan you tu. Kau ingat kau balik-balik tu kau boleh jadi specialist, tak berapa ratus kat depan kau tu, nak masuk jadi trainee, lecturer ataupun untuk ni. Now somebody, I'm sorry I might not understand this so much. How does foreign specialist seek accreditation? Specialist ni maknanya PhD and specialist lah, seek accreditation in Malaysia. How long? This is relevant because you might get your European master degree here and then you go back semua kan. Okay. Now it depends on your specialty lah, Masa I, and what you're going to do. I think if you're going for PhD, you're definitely going to do research, and then maybe your place is in the universities. And depending on what is your researching, and most probably the universities might give you a red carpet. You nano, theta, technology contohnya, tak pernah dengar ada orang tu so mungkin lah Tapi kalau misalnya your research is biasa-biasa je, then you must know the networking. Okay, so thank you for this question. Nampak orang ni betul-betul memandang jauh lah psychiatry. I think psychiatry is a very important and because now we are educating our population not to go to the psychiatrist only after you dah gila. You ada rasa emosi yang swing-swing tadi pun you boleh pergi dah. Ni tak pergi psychiatrist gila. So we need more psychiatrists. But okay, I always respect and admire my friend who are psychiatrists because I just admire their patient in sitting there listening to patient. Sampai kadang-kadang you question your own sanity. So I found as a student, I found psychiatric posting very tiring. Sebabnya kena dengar gitu. Satu aku memang banyak cakap kan, jadi bila suruh dengar tu penat lah So cakap tak penat kan. Lepas tu dengar, and then nanti kena analyse. Is this fleeting train of thoughts, fleeting thinking, or is it paranoia, is it anhedonia? Tu aku susah lah But I guess whatever it is, you must remember, you as doctors must know your limitation. That is another thing. Bukan bila kita doktor ni kita boleh buat segala-galanya. Okay, I just lost a friend who is a psychiatrist due to some advanced cancer, but I guess till the very end she was treating herself. She did not really let go and allow people to doctor her. When she was already very, very ill, I said, I think you have to go to the hospital. No, I'm fine. Of course you are not fine. No, I do not want to trouble everybody. I said, wow, for goodness sake. And she's a psychiatrist. I guess psychiatrist is being trained so much to, I'm fine gitu kan. When you are not fine agaknya lah. No, I do not know, God bless her. Sebenarnya itulah agaknya know your limitation and everything. I'm not saying that my arwah friend ni tak tahu limitation dia, but I guess I just couldn't understand because I'm a very transparent person. When I'm angry, you know. When I'm sad, you know. But this friend of mine, I hardly know what happens in her brain and her mind because she's very good at keeping it to herself. Prof, boleh tak explain apa yang dimaksudkan self-regulation? Thank you. Now with that, maybe kita tutup dulu Now when you say remember, it is self-reflection, then self-regulation, and what follows that is self-correction. Okay. Self-reflection tu adalah muhasabah diri. You boleh fikir apa yang you buat tadi tu. Now let's just reflect on your keberadaan you di sini ni. Reflect. You've been here since morning sampai ke petang ni. Have you benefited? Ke aku sakit leher je sebab tidur terpaksa macam tu mana apa yang kau dapat contohnya now and when you reflect you try to see the perspective, not just your perspective but also my perspective or other people's perspective. Bila I suruh you reflect tu, you cannot just come up with the conclusion, oh I'm good. Says who? Says me. Dia tak boleh gitu. I'm good because everybody thinks I'm good. It is also the perspective of others. That is reflective. Now from reflection you discover a lot of things. Some of you yang tak pernah discover benda-benda new ni is because you tak reflective. When you are reflective, you will discover a lot of new things about yourself. You get to know more about yourself, and that, the next step of after knowing yourself is to regulate yourself. Tu tadi, yang mood swing tadi kan, baru you perasan you mood swing macam ni you nak regulate supaya mood tu okey je. Siapa yang kata patutlah aku rasa tak best saja ni, sebabnya maybe parents aku je yang paksa aku ni. So how do you regulate yourself with that? And then hopefully with that you become people who are in control of yourself. Malam ni nak tidur pukul berapa? Berkobar semangat 10:30 nak tidur. You are regulating yourself. Atau sebelum ni memang you dah 10:30 tidur. So you kata, betul lah tu, aku bukan tahu teori tu, tapi aku betul. So you keep with that thing. Whatever is good, you keep, or you increase, you upgrade. Atau yang tak elok, you correct. Do you understand that? Now at the end of the day, after being with you all, I'm not worried about you. I know you're worried about yourself, but I'm not. I've seen enough people going through me. They will be fine. You will be fine. Just mark my word. So whenever you see me again, dekat koridor UKM ke kat mana ke, can you just say salam, hello to me, and just remind me, Prof, I saw you in check. So tapi tu tengok juga lah, kalau you dah makin bagus tu you katalah kan, tapi kalau you tak berapa bagus, maybe you pun lari-lari lah but I pray that you all are getting better, insyaAllah. Okay, itu saja. Wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.